Okay, I'm sorry. In Richley Technologies, let me just make sure I can move these slides. Hold on just a second. I may have to revisit this. Just a moment. For some reason, the slide is not coming up. Hold on just a second. Um,
We
well, let
see
me
it
get
now.
started since I don't want to run out of time. And Richley Technologies is a company that is rolling up, disrupting the e-commerce side of the multi-billion-dollar membership organization industry. Things like fraternities, sororities, Rotary, Mason, that sort of thing. This is a marketplace of individuals who are intensely loyal to their brands, and they purchase a lot of merchandise. The problem is that these industries, these organizations have been plagued by predatory vendors for as long as we can remember and stealing royalty revenue from the organizations themselves. So Enrichly was founded by the national leaders of the Greek industry, those with entrepreneurial experience, those who were wanting to solve the problem of their ancillary revenue. I'm sorry that you're just not getting my screens here. Okay, there you go. Where our model is very simple. We have four sources of revenue. We establish a storefront on the national organization's website. We have a B2C business where we sell on the national website, and we also sell at regional and national conferences. We also have a B2B business where we sell directly to the national organization, and we sell to the chapters for resale to their members. Our business is very simple, couldn't be any more basic. We buy products from licensed vendors. The vendor will then pay a royalty to the organization based on the wholesale price. We mark the product up and we sell it and we capture the retail gain. Our average markup is about 75%, which gives us about a 40% gross margin. We also run very light on the SG&A side, so we have significant leverage on our SG&A. We have been generating income since day one. We are now running at about $100,000 a month on revenue through just the five client organizations that we've established so far, four of the largest Greek organizations, and just recently the United States JCs, the Chamber of Commerce, which proves that we can also do this for the non-Greek membership world. We also have an organization we've just entered into a memorandum of understanding with that is going to give us 48 additional Greek organizations. That's about an eight or nine-fold increase in our client base overnight. We want to take that opportunity, but we have to first start hiring the personnel and we have to refine our supply chain, which is why we're in the fundraising world right now. This is, as I said, a very simple, very basic business model, but the total available market is huge. $400 million a year in merchandise is sold in the Greek world, and over 16 billion is sold in the membership world generally. So we have a huge total available market. We're looking at EBITDA projection through our model of around 17 million by 2030. And that doesn't include the data that we'll be accumulating on these highly affluent and highly educated consumers. And it doesn't include a subscription opportunity that we've put together. We have a strong management team made up of the leaders of the Greek world, but our operating staff is only 27 years old generally on average, so they understand the consumer. We are looking to raise $2 million. We've already raised $2 million from um, Greek alumni who understand the problem and believe in our solution. And we're trying to raise another $2 million so we can refine our supply chain and hire the personnel that we need. And we have a very well-established exit strategy. Any one of these companies would be better off to buy this industry from us rather than to try to create it themselves because we have the insider relationships locked in, and they would need us in order to do that. Um, Last slide. We tick every box that I think most investors are looking for. We have a strong business model. We have an unassailable competitive moat. We have a clear path to profitability and a good exit strategy. So we're just about anybody needs us to be. Paul, that's all I got.
What's your fundraise ask?
We're asking for $2 million. We're selling convertible notes with the $7.5 million um, $7.5 million cap and a 20% discount.
Great, thanks. So back to the investors. Who has the first question there? Let me call people out. Dan, how about you? What's your question?
I'm not that much into e-commerce. I guess I guess I wasn't clear on your go-to-market paths and strategies.
Well, we have insider relationships with all of the national Greek organizations because our founders, our shareholders are all leaders of the Greek world. So it's a matter of each one coming on board, and then we set up a website for them. This is a white label website, so it costs very little for us to bring on any additional client. And then the articles are sold either through the website, through the conferences, or directly to the members.
Well, no, earlier in the go-to-market, how do you develop leads? What's the sales? Do you have a direct sales or do you have any distribution or
Yeah,
partnership?
yeah, we have a direct to consumer sales through the websites and through the chapters. We also have business to business sales with the national organization and with the chapters. In terms of gaining new clients, we've got a whole list of people who have asked us if they can sign up with them. We just can't take them yet because we need to invest in the personnel and we need to refine our supply chain so that we can give them the service that they expect.
Thank you.
Sure.
Great. Steve, did you have a question? Hmm.
I had a question.
Go ahead.
Yes. So, quick question, Lynn. How many HBCs have you approached?
Boy, there's a nugget that we're trying to get cracked. I mean,
I'm telling you, that's one to be cracked. My brother's the athletic director at Hampton University.
yeah, yeah.
Yeah.
That's a whole branch of the industry that I know if we can land that, and we are in conversations with a couple of the Divine Nine right now, but we have not yet been able to sign them on. Frankly, when we do, that's going to be a huge bite because those organizations are massive in terms of their alumni membership, not just undergrad, but mostly alums.
And
Yeah,
dedication as well.
pardon me.
And dedication as well
Oh
to
my
the
gosh.
to the
Yeah.
chapter.
I mean, it's amazing what the engagement that they have from the members. But yeah, good, great question, and it's on our radar, believe me.
Good.
Great. That's our time. Thanks so much, Lynn. Thanks, Glenn, for a great question. And you too,
You bet.
Dan. With that, let's go ahead and move to the next presenter. We have with us next Zero Pack. Go ahead and launch the slides and kick off when ready. Zero Pack got an 81 on the investability score. Zero Pack is the first truly scalable and scientifically credible PEF engine.
Luis?
Luis, are you ready? Luis, are you ready? Yes, you, Luis. Oh, you're on mute.
He may be on a phone call.
Ah, okay. Maybe it's time. Luis, you're up.
Oh, it's me. Sorry. I had another call coming in.
No, no
Sorry
problem.
for that. So
We're
let
ready
me.
when you are.
I'm ready.
Go and launch your slides and kick off.
Can you see my beautiful bird there? Yeah,
It's coming up. Yes.
fantastic. So first of all, thank you for having me here. My name is Luis. I'm one of the co-founders of ZeroPack, quite an early stage company, and stepping into an industry that, unfortunately, especially for the US environment, is not the most sexy theme at the moment, which is working on the climate change issue and new technology. So, let's hope I can incentivize you guys and tease your appetite towards zero pact. So a very kind of an appealing pitch we have here. So I would like us to start by imagining a world where every single product and every single delivery event has a CO2 label associated with it. But what if I now told you that this is fast becoming a reality? Because in Europe, I don't know if you're aware, this will become mandatory from 2027 in almost close to 90% of all product lines. So in terms of regulation, that's what's happening. Then we have the market pressure on the other side. So we have giants like Amazon that are already requiring to know the CO2 emissions for every delivery they do. So for every day, that's more than 20 million shipped products every single day by Amazon that need to be calculated. So this is no longer a matter of if, it's actually a matter of when, because every single product, every single delivery will have a CO2 label associated. So clearly, when we found this, we immediately thought, are we actually facing a once in a lifetime business opportunity? Because someone needs to solve this. But before diving into kind of harsh conclusions, we had to test how hard this could be. Because if this was an easy task to do, everyone would do it. So we actually picked the smallest and easiest example we could find. So we picked up a small fashion store with only 200 products on its portfolio. Just to calculate the CO2 footprint of each one of these products, we had to process more than 2.8 million different data points. And we would have to do this every single year because these companies and these stores, they renew collections every season. So clearly, this also reflects into very costly and very lengthy processes. So just for you to have an idea, the typical legacy consultants, Deloitte's, PwC's, even the typical sustainability consultancy firms, they charge up to 20,000 euros per report per product, and it can take up to 6 months. So at least one thing we can conclude right now, it's a nightmare for companies to do these sorts of calculations, and will become an even bigger nightmare once this becomes mandatory, as it's about to become. So right there, we as ZeroPact had found our mission. We were going to build the first fully automated and affordable CO2 product labeling tool. So how did we crack the code? First of all, the main bottleneck here is how do we get the data? Companies struggle to get data. Companies have huge value chains associated, supply chains, etc. So we make this easy. We automate the data ingestion. Of course, AI here has a huge role on it. So we ingest all the data around the product's lifecycle. We then insert our calculation engine that was built applying what is a certified compliant lifecycle analysis method under a specific ISO. We're about to become the first ever certified method, let's call it software engine to calculate carbon footprints by SGS, one of the largest quality assurance companies in the world. And finally, once all of this is done, we export the reports, or we actually allocate all these findings into the product pages in e-commerce, into catalogs. Even we produce high-level reports for auditors. Really important now is graphically showing you how then the calculations, that mid part of the process, is done. So first of all, we scrape through AI all the information around a specific product's life cycle, so to make this easy for the clients. We then break down the value chain of every product to identify every single CO2 generating event across its value chain from cradle to grave. And finally, of course, I'm simplifying this, we index all of these events with all the certified emission factors that are spread across dozens of certified databases. And we do all of this aligned with the methodologies that provide the credibility to this. Finally, we deliver all of this through what we call quite a beautiful SaaS platform. Companies immediately and automatically have access to all their products' CO2 footprints. They can track their sales emissions. They can have tips to reduce.
We're at 5 minutes. Can you give us the fundraise ask?
Oh, sorry. I still have so many things to say. Okay. So in a nutshell, we just raised close to $700,000 from the largest distributor of Amazon products in Portugal and Spain. We had to drop one of our co-investors. He was behaving badly. So we got short in our round of between 350 to 500,000 euros. So we kind of looking to a co-investor to reinforce our investment round. It gives us a 24 months runway. and allows us to step into the actual construction of our own small language model that
Great.
will allow us to become the true carbon footprint co-pilot.
Great. We have another investor joining us, Tasha Kudashkina. Tasha, do you have a question for him?
No, not yet. Thank you so much, Ho.
Okay. Dan, any questions from your side?
Yes. A question I have for any company I see. Where is the legal entity in which the investor would be investing? Where's it
It's based
based?
out of Portugal. Right now, we're basing out of Portugal. So it's a European entity. So and right now we're raising funds through a safe mechanism, convertible note, which will convert at a multiple based on sales in 20 months from now, but kept at 4.5 million euros of valuation.
Thank you.
Right. Jeff, did you have any questions? Maybe not. Chris, how about you? Chris Coombs? Oh, Jeff, you're there. Great. What questions did you
No,
have?
not really, actually. It's interesting, but I don't know enough about it.
Okay. Just
Sorry, I
checking.
wasn't sure if you were
Many
talking to me. I
No,
don't.
no.
I don't have any. I don't have any questions.
All right, great.
Interesting.
Chris, how about you?
Yeah.
Yeah, does this cover, do I understand it correctly that it's covering scopes 1, 2, and 3 emissions when you're calculating the footprint?
Scope 1, 2, and 3 relate to corporate emissions. This is related to products.
Oh, okay. Got it.
So what it means is because you're covering the entire value chain, a product carbon footprint as percentages of scope 1, scope 2, scope 3, depending on how we internalize the value chain. And this is a different type of product, so that's why we're not stepping in that saturated market of the carbon accounting softwares you have. We actually nailed the most difficult part of what we call product carbon accounting, and it's becoming mandatory. So if it's becoming mandatory, companies need to have a tool to solve this problem. We're the first one that enables this to happen. And just on the Amazon issue, just unbelievable. Every single delivery needs to be calculated, the emissions. And of course, the largest distributor of Amazon in Portugal and Spain immediately invested in us because they needed us to solve that problem. And this will happen across every single distributor across the world in Amazon. And Amazon still hasn't developed its own framework, or it has a framework, not the software that allows these distributors to do this. So hopefully we're about to develop that for our investors, which are also operators. And once we have that, we'll present this to Amazon and ideally turn this into a global tool for all the distributors of Amazon. This is one of our articles.
Great. And that's our 3 minutes. Thanks so much. And thanks for the great question, guys.
Oh, do you mind if I leave because I need to get back to my kids? If you then need me.
No problem. No problem. We'll be moving on, so you're free to go.
Thank you.
Next up is Orphagen Pharmaceuticals. Scott, if you could launch your slides to kick off when ready. Orphagen got an 81 also on the investability score. They are developing a first-in-class small molecule F1 antagonist for adrenocortical cancer. So with that, I'll let you kick off, Scott, when ready. You're on mute, Scott.
Thank you. Again, I'm CEO, a scientist, entrepreneur. We do small molecule drug discovery for oncology and other diseases. Our lead program is OR449. It's a precision therapy for a rare and untreatable cancer called adrenocortical cancer and some expansion indications. And our pitch is that with a $2 million safe note, we are able to start a phase 1 trial and unlock significant non-dilutive grant support So the problem is that patients today get very poor care. Sorry. Typically very difficult to diagnose this cancer, even at the best hospitals. Current medical therapy does not work. Later efforts like salvage immunotherapy failed for this patient, Sarah. Typical median survival is 15 months. She's a perfect example of what's happening today. The problem is that mitotane, the one FDA-approved drug more than 50 years ago, has no efficacy in randomized trials. It's very toxic. Nothing else thrown at the disease has a major effect. The consensus of the medical community is that you're better off going to a clinical trial. So our academic colleagues have shown that SF1 is likely to be a tissue selective driver for ACC, and we're the ones that have gone after this class of receptor and identified antagonists to SF1 that block tumor growth in preclinical models and taken OR449 close to the clinic. So why get involved in this area? Well, first, rare disease drugs have premium pricing, as shown on the left, close to $500,000 per year. This happens in the US, of course. And then on the regulatory side, the FDA encourages drug development for novel effective therapies, and we could get accelerated approval with treatment of 50 to 80 patients in a phase 2 trial. Second aspect is there is a market. About 2,000 patients a year are treated with the current drug with improved patient survival. Additional clinical trials, one gets to 5,000. That has peak revenue potential of $1 billion a year. As mentioned, we discovered OR449. We've got patents. The IND enabling studies are complete. We've talked to the FDA, and most importantly, here on the right is an example of the data we have in a patient-derived tumor grown in a mouse. So we're ready to go. The $2 million safe note unlocks a promise of grant support from the state of Texas, which would like to bring companies there to do clinical trials and be based there. So we're looking to raise with that 2 million, or with that 2 million will be matched by additional funds. And our first year goals include IND approval and the first patients enrolled. We'll then go for a seed Series A funding that will get us to initial safety, PK, what we call target engagement, showing that our drug goes where it's supposed to. And finally, first clear signs of efficacy. Each of these steps create a tremendous value inflection. And to give you an overview, we'll be looking both at adult ACC and at pediatric patients, and both have very special value exits, particularly in the case of pediatric. And these two trials will synergize with each other. We need the adult safety to go and work with pediatric patients, and vice versa. The pediatric data will strengthen our adult trial claims. That we're raising the safe note with a $10 million pre-money and 20% discount. We have a very experienced team, both in academia and industry, in oncology drug development. And so I'd like to sum up. We are raising a $2 million safe to get the very earliest exposure of patients to this drug. There's a potential for peak sales of $1 billion a year, which is unique to this cancer because current therapy is so poor. And there's a potential, and we'll be able to reduce the risk with funding from the state of Texas. So I look forward to your questions.
Great. Clinton, did you have a question?
I'm just taking my notes right now. No questions at the moment.
Okay.
Anybody else have a question at this point?
Yes, Paul. Hello, my name is Taya. I do have a question though. So I might not be from the industry, so maybe my question is a bit out of the sky or out of the blue, but still.
No problem.
what is your go-to-market strategy? I don't know how it's done in your case, but do you have somebody in a team who understands how to work on a distribution strategy, how to sell, how to get it on the market? Because I haven't seen anything on the slides for that.
Yes, yes. First thing, of course, is to get FDA approval of the drug. Second part of our strategy is to get approval as first-line therapy, which we think is quite feasible, so that we have rapid market uptake vis-a-vis the current drug, which, as I mentioned, does not work well. And we do have commercial consultants who give us feedback on our clinical strategy, so we answer the right questions that allow us to move quickly once we hit the market. Does that make sense? Oh, Taya, go ahead and unmute yourself.
Oh, sorry. Yes, it does. Thank you so much for answering.
Okay, love to talk to you further.
Any other questions while we're waiting? Can you talk about the grant funding that's going into this? Who's supporting this?
State of Texas, or the voters of Texas, have voted to put $4 or $5 billion into cancer research, and about half of that is for product development. So we got this 10.2 million grant after very intensive review. And once we raise the 2 million, we get 2.5 from the state of Texas, and then each year as we meet milestones, they free up more of those funds, as shown here.
Any other granting agencies you're looking at in Europe?
We are looking at a foundation in Europe that's interested in ACC. That seems to be our next best prospect. The kind of an interesting point here is our 2 million is going to be, of course, our smallest raise, and that's because the early stage of the clinical trial is less costly, but the time that it saves is huge. Every dollar or every month that we accelerate the raising of the funds means we get this drug on the market a month earlier and get that revenue 5 years from now.
Great. That's the
So
end of our
it's a
3
beautiful
minutes.
opportunity. Thanks, Paul.
You bet. Thanks so much, Scott. Next up, we have Helio presenting. Tom, if you could launch your slides and kick off when ready. They have a score of 82 on the investability score. Helio is the SaaS engine driving healthcare's operational future. They are a portable organ testing and preservation device.
Thanks, Hall. Can you see the slides?
Yes, we do.
Very good. I'm Bob Boosner, president of BMI Organ Bank. In September of 2022, I got the call no parent ever wants to get from my adult daughter. She let me know she had polycystic kidney disease. She'd likely need a kidney transplant someday. I learned about the space. I dug. What I learned had me frustrated and worried, but the good news was I found BMI Organ Bank, and we're well on our way to solving issues of getting kidney transplants. So if someone you loves had type 2 diabetes or high blood pressure and their kidney failed, they'd have 2 ways to stay alive. If they can get a kidney transplant, they've got a great life and a great outlook ahead of them. If they need to go on dialysis, it's very grim. Patients often die while waiting for the kidney. And the frustrating thing is nearly 90% of donated kidneys with transplant potential are going unused because doctors can't tell if they're going to work. On top of that, this is an overwhelming economic issue. Transplants save payers $500,000 apiece, but payers can't get them for their patients either. I'm going to talk about the solution in a second, give you a sense of the team. Carrie DiMarzio is our CEO. I'm our president, 25 years with Johnson & Johnson. If you can do it, I've done it. Other operators on the team. And to give you a sense of how the field is rallying around us, we'll highlight in the upper right, Dr. Roy Chowdhury is the recent president of the American Society of Nephrologists. So really the #1 kidney doctor in the world. We're very proud of our capable team. So getting back to the problem, if someone you loved needed that kidney to save their life, it would come to them from a donor in an ice cooler just like you drink your beer from, or the LifePort kidney transporter. That was approved 23 years ago. You heard how broken things are. this space is so ripe for disruption. When we talk to kidney transplant surgeons and say, what is it going to take to use those kidneys you are throwing away today? They say, I need to be able to test them. And by the way, I'd like to keep them alive for longer outside of the body. BMI Organ Bank is positioned to do both of those very well. You heard about cold preservation, that's hibernating kidneys. They simply die more slowly outside of the body. With our partners at Duke University, we have perfected room temperature preservation. We keep those kidneys alive outside of the body. You can observe how well they are working if you're a doctor before saying, I'm going to throw this away or take it. And we can keep kidneys alive for multiple days outside of the body, which we've done with human kidneys already. This is a kidney over 24 hours on the device. You can see the one on the left does not look good. That bruising look is microcoagulation. It cleans up over 24 hours on our device. You can see how beautiful it is. Most important thing is the transplant surgeon quote on the right. He would have thrown away the kidney on the left. He'd use the kidney on the right. That's $500,000 saved. It's probably a life saved. So just to give you a sense of where we are, the device is on the right there that provides advanced testing for kidney viability, fully portable. If the transplant surgeon likes what they see, the whole thing goes to the transplant center. We have FDA breakthrough device designation. We just got that over the summer. Strong patents. This is a large market, highly unsatisfied, but a small number of customers, so we can scale if we're not acquired. We have reimbursement in place. We can provide that in writing. A company that does what we do for livers, we're focused on kidneys first, was just acquired for $1.5 billion by a large med tech in Japan. And we've raised almost $9 million in non-dilutive funding. This $6 million seed round helps us be shovel ready for clinical studies. We will then fund the clinical study execution with a Series A of $30 to $35 million. If not acquired, a Series B would likely be our last round. And I know, Paul, you give me the chance to say our raise, but I'll say it now. We are raising $6 million. We have already collected, wired $3.8 million, looking to close the round. If you're on this call, you can play a part. And you would be co-investing with the National Kidney Foundation Innovation Fund, Band of Angels, Golden Seeds, Wexford SciTech, Park City Angels, Mid-Atlantic Bio Angels, transplant surgeon investors. We have 3 deal members available. Thank you.
Great presentation, Bob. Who has the first question?
I can start.
Go ahead.
Hello, my name is Taya. So I would like to go back to the slide with the ask. Like, so you're asking for 6 million, and you call it a seed. And previously you have raised what, 13, right? Why does it look like this? Explain me. Why is it a down round? It looks like a bridge round or something. What's going on there?
Yeah, no down rounds. Much of the funding we raised before was non-dilutive funding. We typically don't count that as investor funding, and it's really built out our pipeline, not our kidney product. So it is a fair deal, but it is not a down round. Yeah, and just to kind of back it up, and we just had several large investors come in. They were pretty comfortable with where we are.
Jeff, what questions do you have?
Yeah, I thought the pitch was really good. Answered a lot of questions I would have already had. Out of curiosity, does the organ bank have broader application potentially? I know the focus here was on kidney on this particular use case, but is there other organs that you can target, and is there kind of a broader application?
There is, and I know we rush a little bit in these presentations, but we have a already liver transplant program. We've done livers on our device, and we're advancing the engineering. So that's the second biggest transplant market today. We have a partnership with Stanford to pioneer whole eye transplant to cure blindness. longer time cycle, huge opportunity. We have Department of Defense funding for limb preservation because of the battlefield applications. And it all builds beautifully. Thank you, Jeff.
Thanks.
One more question. Dan, what's your thoughts on this?
This seems like a big opportunity. I didn't quite get the absorb maybe if we saw it the timeline for the FDA approvals and so forth.
Yeah. So Sure. Yeah, we'll start the clinical study later this year. We project FDA approval in late 2028. We have designed an interim analysis about halfway through the study, and there is history, if you have positive data, interim analysis opportunity to be acquired before the FDA approval.
Thank you.
And we're happy to provide some historical analyses there. Thank you, Dan.
Great.
And thank you,
That's our time. Thanks so much, Bob. Thanks, guys, for great questions as well. With that, let's move to our next presenter, Pivotal Health. Sal, if you can launch your slides and kick off when ready. Pivotal Health got an 83 on the Investability Score. It's a tech-enabled direct care platform delivering house calls and telehealth for university students.
Okay. Paul, thank you very much, everyone. Good afternoon. I'm Sal Braco, the co-founder and CEO of Pivotal Health. We are a tech-enabled healthcare company that is fixing the very broken healthcare experience for university students. So picture a university student named Samantha. You know, she wakes up sick on a Tuesday. She's got a fever, a sore throat. First thing that she does is call the University Health Services. The University Health Services is booked for the next week and a half. This is a very common thing. So she thinks, well, can I go to an ER? Not sure how she's going to get there, but she's also not sure how much that's going to cost. So she calls her mom, who's about 1,000 miles away. The mom feels helpless. She doesn't know how she can help her daughter. And again, this is a very common occurrence on US universities, especially large universities. Parents are desperate for a solution that is accessible, transparent, and safe, and they're willing to pay for that. And so at Pivotal, we have created this platform, this whole health hub that comes directly to the person for urgent care and for primary care needs. We bypass the complexities of insurance and waiting rooms by having our Pivotal Health providers go directly to the university students' dorm rooms and apartments for urgent care and for primary care needs. So the experience is seamless. There's the Pivotal Health mobile app. This is in the app stores now. Very easy to create your account, to add any family members if it's a family signing up. When you want to schedule a visit, you just tell us where you're located with a couple of clicks. You tell us if it's a sore throat, if it's an ear infection, if it's a UTI, whatever that it is. Then you pick a time that works for you. We're typically seeing people on the same day. But for our members, there is a 24-hour guarantee. And Pivotal Health provider rolls up to the person's dorm room or apartment. Over 95% of our visits are booked with the Pivotal Health app. So sometimes people ask us, is this just a mobile clinic? Well, the answer is no. This is a logistics business as much as it's a healthcare business. We have created a tech platform from scratch specifically for this purpose. We're automating everything around the visit. Okay, so that plus the density of a university really allows us to see a lot more patients than what you typically would. So we operate on a direct care business model. This means we do not accept insurance. Our current university membership fee is $400 per semester. That gives the consumer as many urgent care and primary care visits that they need. We're also able to very cost effectively acquire these customers, and I'll explain more later, but our LTV to CAC ratio is 22 to 1. This isn't just a theory. We've done over 16,400 visits. In 2025, we did over $1 million of revenue. The platform's built. We're raising capital now to scale this to more metro areas. The university market is a multi-billion-dollar TAM. Okay, so how do we grow? Well, the answer is mom. Mom is the main decision maker for university students. We know how to very cost effectively target mom via social media, via university Facebook groups, and a variety of other ways, but we can get to mom, and she's the one that is the most concerned about this. So my co-founder and I have over 20 years each of me, healthcare, him, tech experience, a great deal of background in healthcare operations, tech operations, capital raising, et cetera. So we're raising up to $5 million to expand to up to 8 more metro areas. Again, the platform's built. There's a huge problem. We're ready to raise the capital and go.
Great presentation, Sal. Who has the first question?
Hi, Sal. Great presentation. I have a quick question for you. As far as your target market, are you looking at some areas that have a condensed area of universities?
Yeah, so we're looking at metro areas that have at least 250,000 people with a university population of at least 25,000. There's no shortage of those in the US. Places like Ann Arbor, Michigan, Tucson,
Nashville.
Columbus, Nashville, Austin, Texas, Miami, Boston, New York, Philadelphia. I can keep on going. Washington, D.C. I mean, there's a lot of places like that that fit this.
Thank you.
Who else has a question?
I do, Hall. This is
Go ahead,
Dan.
Dan.
What are the terms of your raise, and how were they set? And do you have a lead investor?
We do not have a lead. We are looking for a lead for the round. Like I said, we're raising between $2 and $5 million. This would be a preferred stock round. Right now, we're looking for a valuation of $15 million pre.
And how was that number set, derived?
That's what we are setting it at. But as I said, we are looking for a lead.
Okay, thanks.
Okay, great. Any other questions? Talia, you have a question?
Yeah, just a follow-up question to the previous question. So it says that you previously raised 3.9 million, right? So is it self-funded? Is it your money, or did you have investors? Are they gonna join this round as well?
It was partially myself and my co-founders. We also did raise money from some high net worth individuals. There was a pre-seed round and then a seed round. Likely a number of them will come in on this round. We're just looking for the lead.
Okay. And if you do have some numbers to show from the unit economy, like I'm just interested in like what's the marginality for each visit, for example, right? Like what are the marketing costs? Like, can you share those? Yeah.
Sure. Yeah, no, I mean, these are software like margins. I mean, with the membership-based model that we have, this is SaaS like revenue. So there's a positive contribution margin with the very first visit. I can definitely share more about this, but the margins are actually very, very good.
Yeah, it says 86%. It should be good.
It is. It is. All right, great. That's it. That's it for our 3 minutes. Great presentation, Sal. Great questions from the investors as well. Let's go to our next presenter, AngieX. Paul, if you can launch your slides and kick off when ready. AngieX got an 84 on their investability score. It's a clinical stage oncology company developing AGX 101.
Yeah, thank you, Hall. So I've got a very exciting drug to tell you about, very exciting company. NGX was founded by scientific leaders in the field of angiogenesis, that's the formation of new blood vessels, to make a universal therapy that would work by eliminating the tumor blood supply. So that can be, in principle, a universal therapy that works against every single tumor, any growing tumor. And they found a way to do it. And it turns out that the biology that they found to attack is not only important for the tumor blood vessels, but it's important for the tumor cells because it's what enables the mesenchymal transition, which turns the cancer cells into invasive and metastatic tumor cells. So we've been able to make a drug that can eliminate the tumor blood vessels and also kill the invasive and metastatic tumor cells of the tumor. So potentially a universal therapy that has the potential to eliminate mortality from solid cancers. And it's also has great potential for safety because this biology enables growth. And in adults, the tumors are the only growing part of the body. So we have our drug in clinical trials. And this is the fruit of 23 years of biology research, 12 years of drug development. And so you have the opportunity to come in at a critical moment just before we prove that it works terrifically. And I'll summarize our clinical data a little bit later, but it's performing well. And you have the opportunity to enter. The post money on our last round was 50 million. There's an opportunity to enter to equity at that valuation or by convertible note. And companies with comparable drugs after approval have reached valuations 1,000-fold higher. So this is what the drug does in a mouse model. So this is the elimination of the tumor blood vessels. And you can see we eliminate the vessels in the tumor, but we also eliminate the large vessels that feed and drain the tumor. That leads to a necrosis in the middle of the tumor, and the tumor shrinks. One complexity, it's a wounding process, and the tumor can heal by scarring, which is something that we've seen, which slightly complicates the interpretation, but that's also made this opportunity to invest available to you. And this illustrates, because our target is high in every invasive or metastatic tumor cell, in late-stage cancer patients, they've got a lot of these tumor cells, so we can basically kill a lot of tumor cells in every late-stage patient across all solid cancers. And then this speaks to both fundraising timeline and clinical timeline. So our clinical timeline is in 2026. We're basically completing the clinical research, figuring out everything about how to dose. In 2027, we'll do the pivotal trial, which will get us to approval. In early 2028, we'll submit our application for drug approval, and then it will be approved later that year. And the basic timelines over the next 6 months, we'll reach what's called proof of concept, where we demonstrate responses and response rate. And oncology companies that have reached proof of concept are valued 10 to 20 to 30-fold higher than we are today. And so there's a very imminent value inflection. And then after approval, ADC companies have been valued north of $10 billion. So our goal right now is to do a top-off financing to maintain runway as we gather this next 6 months of data. And then once we have the data in hand, we'll raise probably something like a $50 million round at a much higher valuation, maybe 10x from today. And then we'll follow that with a crossover and IPO in 2027. There's various ways to commercialize. One of the common ones is to out-license. Comparable drugs have gotten billion-dollar upfront, so that would be profitability. Otherwise, profitability comes after approval with revenue. We have an outstanding team. I myself, four-time entrepreneur with successful ventures. Our executive chair led BD at Amgen, led BD at Merck, and has been CEO or chairman of a number of biotech companies, public and private. Our CMO has done 150 clinical trials. Our manufacturing team, best in the business in ADCs, 7 approved drugs, $70 billion of corporate acquisitions. And our CFO, investment bank, led the life sciences investment banking practice at Goldman Sachs and other companies, and has been a 4-time CFO. And our scientific founders made the top 2 discoveries in the field of angiogenesis. So in conclusion, as I mentioned, a great opportunity to come in at a valuation in line with clinical stage oncology companies in phase 1 that don't have working drugs. And we believe our drug is performing great. And you get to come in just ahead of the value inflection. I said I'd mention, I'd describe the clinical data. And so what we've done, we made a first pass through our dose escalation. We haven't found any dose that's not tolerated. The highest dose we've dosed at was 6.7 milligram per kilogram, which is higher than any other tubulin inhibitor ADC has ever reached. So we have fulfilled our expectations of a very safe drug. And then on the efficacy side, it looks like we have efficacy from 3 milligram per kilogram and higher. So at least 3, maybe 4 distinct dose levels have been effective. But the level of efficacy has been obscured by the fact that our vascular mechanism wounds the tumor, and the tumor wound often heals by scarring. And the scar is a permanent lesion. It's a dead lesion that's not growing, so it's not harmful, but it doesn't disappear on CT scans. And that's made it hard for the doctors to know what the response is, or when to stop treatment, how well it's working. And so we've introduced PET imaging, and we're redoing the last 3 dose levels of the dose escalation. And so that should give us very clear evidence that the drug is working well. Even at the lowest one of those dose levels, we had, for example, a metastatic pancreatic cancer patient who stayed on trial through 10 cycles of therapy for 7 months with no tumor growth. And he was no adverse effects through most of those cycles. He was playing golf, working, living normally. And he's still alive today. We might have eliminated his tumor cell population, but you couldn't tell because apparently we left a scar where his tumors were. And so we believe the PET imaging will prove that we made a fantastic drug, and we hope you'll join us. And there's a lot of cancer patients who need our drug, and the only thing limiting us is money. So the faster money comes in, the faster we can go to approval, and the more lives we can save. So I hope you'll help us. Thank you.
Great presentation, Paul. We have time for one question. Who has a question? Can you talk about your grant funding and what you received and who's supporting you from the clinical side?
Yeah, so we've never gotten a grant, so what we're doing is too innovative. There's nobody working on it in academia or the drug development industry. And but I think once we publish clinical data, then everybody's going to jump in, and it'll be easy to get grants. And then the clinical status, we have major cancer centers on the trial: MD Anderson, Dana-Farber in Boston, Washington, University of St. Louis, University of Southern California in Los Angeles. And we turned some away, like Mayo Clinic, just because we have a limited drug supply. So people are very excited about our drug. It's great potential.
Great presentation. Thanks so much. With that, let's move to our next presenter. We have with us next Cell Guardian. Vic, go ahead and launch your slides and kick off when ready. Cell Guardian got an 85 on the investability score. They provide zero-touch AI-driven inmate monitoring for jails, prisons, and correctional facilities. You're good to go, Vic.
Can you hear me?
We hear you now.
Great. Hi there, my name is Vic Ramprakash. I am the founder of Ram Sensor Development. We have a product called Cell Guardian, which we have actively started making sales at this point in time. This monitors inmates in jails. And I'm going to talk to you about a little bit of this product. My background's in remote sensing technology. About 10 years ago, my son had some respiratory issues while he was born, and I was thinking, man, there's got to be a way I can get his vital signs when during the day or something like that, or when he get in the middle of the night if there's some issues. So I started my journey with the University of Florida. We came up with this technology. You could get your vitals with absolutely no touch. So think about a device as size of a cigar box. You keep it a few feet away from you, and you get your vitals. Incidentally, I pivoted to animal market because vets really wanted something like that to get vitals of animals with no touch. We did good. We sold the company for 18 million. I split the technology patents into two parts. I gave the animal side and held on to the human side. So with that, my team and I were deciding what can we use the technology on the human side. We're part of the National ICOP program, and we found out the jails was actually the lowest hanging fruit. If you ever Google jails and suicides, it's overwhelming that people try to commit suicide any day, any time. We try to do that. 1 in 4 people try to do it within the first 8 hours of their time in jail. It can be anything, mental issues, or they just want to get away to the medical care. The other thing is drug ingestion. You don't know who's coming in, how long they're going to stay there. And if they have any probation case against them, drug-related cases, they swallow drugs. So this is one of the biggest issues we found in jail monitoring. So where we come up with the technology? So we have improved the technology. We did it with the animal side. Here we have integrated with AI detection. AI is important because if you ever say show me suicides, you never are going to find anything online. So that's what we've done, simulated models for the last 1 year to figure out how someone can commit suicides, and we can identify them right now. And we're starting to deploy them in jail cells at this point in time. And obviously the biggest reason is, jails are understaffed and overcrowded. So it's very cost effective to a device to monitor jails at this point in time. So it took us about 15 months to get our FDA class 1 at this point in time. Following that, our traction has just been going crazy. Last 3 months, we made $250,000 of purchase orders, signed purchase orders. We have about 6 installs. 2026, we have another 64 installs at this point in time to get to the market. So the takeaway, if you're an investor or anybody else in the crowd, is if you have a speeding ticket, just call me. And the chances I know a police officer is pretty high at this point in time. Getting to know all of them around the country at this point. The technology is multi-sensor fusion technology. So when we started with animals, it was only one sensor, 5.8 gigahertz. Now we have a combination of multiple input, multiple output, 24 and 60. We had integrated a camera already in place, so that tells you what's exactly happening at the same time. With the AI processing, the NVIDIA Jetson Orin, that's the one which does the AI processing for us. So this one powerful device can monitor a person throughout the time in the jail location, and we can use it for multiple people detection as well in the future. So you talk about competition, obviously there's always jail cameras around there, but the other options out there is you can either use AI tools out there. People are trying to use that to use with jail cameras. And there are also physiological devices out there, but where we stand out, Cell Guardian is a combination of showing a physiological changes. We're also able to document data, what's going on, and we store the data for almost 6 months in AWS. And if jails want to know what happened to this person 3 months ago, the data can come to them. So there's already out there wearables. There's jails use wearables, but again, it's a hygiene problem. They wanted to use the product. They got to keep changing them. Camera monitoring is always there. And the biggest thing is manual observations. If somebody has to commit suicide, they have to be monitored every 15 minutes. So just think about it. Suicides do happen in those 15 minutes. Our device can take care of that point of time, whether it's 0 to 15 in any time period of time. If you talk about jails, I'm talking about the entire public safety area. It's about $1.7 billion market space. Any day, 600,000 people are in jails. 20% of them have some kind of medical issues. So this is where our first target market is. Our goal is to get 130 jails out there, and nearly all of them are got to do with medical intervention. Like I said, we have our exclusive patents from University of Florida, all granted. We're adding more patents as we go. I got my own patent, comes to multi-sensor fusion technology. They say first-time founder, you're looking for customers. Second-time founder, you're looking for distributors. We got customers. We're looking into distributors. This is our second year of sales. We're adding more distributors as we speak. And next phase is we're going to work into prisons and going international after that point of time. We have two pricing models. It just depends on jails. I mean, big jails want to buy it as a CapEx model. They want to buy it at the price point about $4,400. We already have some jails who are buying that at that price point. Also, there's a HAS model, a hardware subscription. These are the smaller jails and smaller counties. That's we're targeting at $149 per device. And it's like a lease it till you own it, 48 months lease. Right now, the COGS are $1,000, but we know because of volume, it can come down to $500. We hope to break even by 2028. We are getting more sales as we speak, and we're going to do comprehensive support for every device we have in the market space. I've raised about $1.4 million at this point in time with the first round of seed fund. We're getting to a second seed round at this point in time. It's a 10 million cap, the 8% interest, and 20% discount, 24-month maturity. Like I said, we have an FDA class 1. We're doing FDA class 2. We're submitting next month. We finished all the safety testing. The goal is to just get into sales and marketing for 2026 and 2027.
Great presentation. Who has the first question? Clinton, what do you think about this?
Yeah, I actually have well, my brother's a correction officer. Well, he just retired. So, yeah, so my first question would be, I saw the image that you had. What happens if an inmate, how do you clean it?
Yeah.
Because the
So
inmates, they're going to block the system. They're going to throw
yeah.
whatever they have at it. How does that work?
So this product is IP46 rated. That is, it's pressure tested, water tested. So, and that's why we went through the safety testing. We keep it at 8 feet above the ceiling. And, like you just said, fecal matter can come onto it, but because it can be washed, we've done this previously in a pilot area. We've been doing for a whole 1 year. We understand how it takes to pressure wash this device. And with the waterproof testing we have, so far we're not having any issues at this point in time.
Okay. And far as the data that it collects, who keeps that? Or is that, say, for example, if the inmate say they had a problem earlier and they said, okay, actually the monitor was in there, I definitely had 2 people in the cell, would they be able to give that information to their lawyer and drag from that information there?
Yeah, absolutely. That's one of the reasons we have data which can be stored for 6 months. Anybody from jail officers to the legal community who wants to look at the data, it works pretty same as jail cameras. So the data can be stored up to 6 months. They can take a time frame and pick it up and review it, what happened at the point in time.
So when the jail actually buys it, they're in control of the data?
They are in control of the data.
Okay.
Who else has a question? Dan, what do you think of this?
Well, I don't know anything about this market, thank goodness, but it seems to me that the general, I don't know, ethos or whatever of the United States at this moment is rather than spending money on the lower parts of our society, that we're trying to save money and punish anybody who is to blame for anything. So to put it another way, will jails, particularly the privately run ones who are for profit, will are they interested in spending money on preventing any of these bad things happening to the inmates?
Yeah, actually, that's a good question, Dan. You got to split it into two parts. One is, you know, the market itself has been a little bit behind technology, and we have seen the need for the product line desperate when it comes to jails because, like I said, understaffed, overcrowded, and there's suicides happen. So having technology out there which can do this for 24 hours 7 monitoring really helps the jails at this point. If they have anything in place. I mean, like I said, even a few months ago, I mean, I just put it, so to say, Jeffrey Epstein case. I mean, someone committed suicide and you don't know what happened, how it happened. The device is just standing there, gives you all the information you need. There is a demand for the product line, like I said, because of what we did as part of our customer review. And we've seen the traction, will the dog eat the dog food? And we're seeing the scale going in and people buying the device at this point in time. And obviously, we are building up the Guardian platform as we speak, which can be used for other applications. One is we have a signed agreement with Dental Easy Company, which is a manufacturer of dental chairs. Go figure out, they wanted to have sensors in dental chairs as well as medical chairs because they believe most of dental institutions will be converted into medical first aid performance companies out there. So there's a lot of need for this technology, but we do know that the customers at this point are the jails.
Great presentation. That we're out of time. Thanks so much, Vic. Thank you guys for great questions. We'll now go to our final presenter. We have with us Solaris. Randy, if you could launch your slides and kick off when ready. Solaris got an 85 on their investability score, also one of the top ones the X1 team has seen before. And Solaris develops breakthrough covered stent graft and drug-eluting vascular technologies. Randy, whenever you're ready.
He may be muted.
Oh, Randy, are you mute?
Hi, yeah, I'm ready. Let's go. Hey, so I'm Randy Hubble, CEO for Solaris Endovascular. We're a medical device company with a new technology in the endovascular space. Specifically, we have a unique opportunity here for investors. This is an early stage company, but we already have 5 million in revenue last year. It's an MDR CE mark product. Our current commercial OUS asset is Solaris SX, the first of 2 products. It's got meaningful clinical studies already completed and looks great. 15,000 units sold to date. The next generation is transformational. We use the platform Solaris SX and we put a drug-eluting on it. No competitors have this technology. It has dramatically reduced the stenosis rates. We have strategics actively looking to engage on an equity round. We got an experienced management team. We got a very clear strategy to get to a capital efficient exit in 3 to 4 years. And we're offering a value cap that based off of our projections on the next round would be about a 50 to 60% discount to that next round. So here's what we treat. We treat dialysis access patients that have challenges with their access in the arteries and veins. They get stenosis, they need to be repaired. Peripheral artery disease, same disease in the hearts and your lower legs, that becomes very problematic. Our first product has been on the market for 4 or 5 years, and we're on a path to $6 million of revenue this year. It's called Solaris SX. That's a picture of it. It's a self-expanding nitinol stent covered with electrospun PTFE. The edges, as you can see up there, are metal. That's where Solaris DE comes in. We put drug on it. That's a phase 2 product that we have a patent pending on. The product is taking share in both the countries we compete in. We only sell in 10 countries, although we're approved in 45. Number 1 market share in Brazil and Turkey. Our major competitors are Gore, Bard, and Merit. The problem with all stents, including our Solaris SX, is that the restenosis happens on the edges, not where the PTFE is. That's called edge restenosis. That needs to be solved. We have the solution. We put sirolimus on the edges of our covered stent. It elutes over 90 days. Sirolimus is a well-known anti-proliferative drug, very safe. It was used in Cipher, the first ever drug-eluting stent, and it's been approved by the FDA, and we have a patent for delivering drugs from the edges of a covered stent. When you look at the data, we have a phase 2 study. When patients are treated in dialysis access patients, and they have a failure and they're treated with balloon angioplasty, at 6 months, 43% of those patients are going to come back with a repeat procedure, very costly and painful for the patient. With a covered stent without a biologic, we can get that to 75%, which is a big improvement, but you still have that last hurdle, which is the edge restenosis. Our product, Solaris drug-eluting, in our Discover study, we have gotten that down to 5%, 95% patency rate. That picture on the right, that black channel, that's the lumen. The dotted line is the stent, and the white cloudy part is the vessel. What's significant is the vessel is not growing at the 6-month time point. Very relevant. We'll get breakthrough designation as we now have this clinical data. We have great safety data, which is where they start. We have this is a 120 patient study that we'll present to the FDA to get the breakthrough designation and get all the benefits associated with that. The market is about 1.5 billion. We'll double it just like we did with Cipher. I was the launch leader for Cipher, the first drug-eluting stent. We hit $1 billion of sales in 8 months because of the significance of the data. These are the companies that are in the endovascular space today. They have significant sales and marketing infrastructure, but they have no covered stent. And much less, nobody has a drug-eluting covered stent except for us. These are our milestones for the year. We're going to have breakthrough designation. We're going to get the same thing in Japan. We'll have the final results from the phase 2 study and 2 pre-IND meetings. This is the bridge. This $5 million gets us the 2026 milestones on a path to an equity round with a strategic next year. Very healthy sales growth with the product. This drives a discounted cash flow analysis of about a $500 million acquisition. I took Carmel public a couple of years ago. Cardiva sold for $500 million. And we have a convertible note, which is our discount. We have a DD report from Keiretsu Forum, and it's a $30 million valuation cap until February 28th, or up to 1.5 million, and it goes up slightly all the way until June with a 8% interest. The worst you'll do is 25% discount, but we think the equity round will be somewhere $60 to $80 million, depending on the milestones. Thank you.
Great presentation. Who has the first question? Dan, what are your thoughts on this?
I guess my question, Randy, is how much of your time are you spending on this company and how much on other activities?
So this is taking up about 85% of my time, so which ends up being a full-time job. I have I'm on the board of Neuraptive and on the board of Transradial, and got good people that are working there.
Thanks.
Great. Clinton, what do you think?
Yeah, I definitely like the valuation cap on it, that's for sure. And also like the growth that you already have thus far. And my father at the moment actually has a stent in it, so I am very, very familiar with what's going on with stents and whatnot. And he's at time he's in pain, and yeah, I'm waiting for products like this to come out. Unfortunately, I wish it would have been a little bit earlier, but God willing.
Right. And Talia, what's your question?
Well, just a follow-up question. What is your biggest risk? Like, what do you think? What is your challenge now?
Yeah, so I'll put it in 2 categories. One is always financial, just raising money. I've raised money through this approach, angel/family offices. We've got a family office looking to put in $1 million in the next week or so, and then we got 500,000 others on top of that. So that's good momentum, but that's what keeps me up at night, is raising money. Second is just the clinical executing a clinical trial. So those are the things that I'm building the right team to make sure we can get done.
Thank you.
Great. And that's the end of our 3 minutes. We have completed all of the presentations. At this point, I'd like to ask the investors, which ones did you find the most interesting? Clinton, what do you think were the top ones for you?
The top one for me would have to be the clothing or the retail, the clothing and the where was it? I believe it was the first pitch. Did we
In Richley, yes.
Yeah, in Richley, yes. It was in Richley. Also, the the where is it? The bio the pitch where is it now? Not to go through.
Organ
The pitch,
testing or
yes, the organ testing.
BMI,
And
yeah.
yeah, BMI, yes, exactly. I think those two are my two favorite so far.
Great. Dan, what did you find most interesting?
Well, I agreed with those two as interesting. So Elio,
okay. What do you think is most interesting to the virtual angel group that you lead?
well, that's basically
thing?
the same.
Okay.
The same question as you asked me before. What's interesting to the group to me is what I think is interesting to the group.
Okay. Any others, or is that it?
Yeah, those three.
Okay, great. And Taya, what did you find most interesting if you had to pick 3 for you and your group?
Well, I also like BMI organ bank because the problem is very visible. We understand, and the market is huge, and they presented it really well. And that area really needs a disruption. That's for sure. It's been outdated for many years. So, and then I also liked private health. This is how it was called, the one for universities, because I'm a targeted segment myself. I have 2 teenagers, and I can imagine it very clearly. Like, if this is going to happen to me, I would pay those 400 euro or dollars without even looking at the bill, knowing that this can be happen. So it's a very good segment, which is very willing to pay, for something which solves their problem.
Okay. If you had to pick one more, what would it be?
What was the Scott? What was he? Some medical. Wait a second. What was the name of him?
Orphagen.
Orphagen. Yes, exactly.
Yeah, thank you.
Sorry.
All right.
Yeah, I liked it as well.
Also, I like
honestly,
Orphagen too.
Yes. I
Yeah.
actually like the way how you were able to explain it, even though I don't consider myself being a targeted investor for you. And as a personal advice, I think that you should look for very, very targeted angels who understand something in cancer treatment. And I think it's going to be so much easier, for you to find an investor, because it seems for me like a very good solution. You just need to be more focused and targeted with your search.
Okay.
Thanks.
Great. I appreciate that. We will send the investability scores and reports to everybody on the panel today. I want to thank you guys for joining us. Pass it back to Chris Coombs. Do you have any closing thoughts there from your side, Chris?
No, this is all great, actually. Thank you very much for doing everything on the platform. I appreciate all the feedback everybody gave us as well. Anybody who's here, please, it's free to sign up. It's kind of like the new LinkedIn for innovation. So come on, use it. We're going to keep launching new things all the time. app.x1pipeline.com.
Great. Thank you guys for joining, and been great working with X1, and looking forward to future events as well. I'll be back around for feedback, and we'll be giving you the information you guys look for. With that, we'll go ahead and wrap it up for today, and we'll see you guys next time. Have a good one.
Thanks, all.
Thanks, guys. Bye-bye.
Ciao.
Thanks so much.
Thank you, Hall.
Thanks, guys.